Today, I'll be sharing part 2 of retraining walking post-stroke. If you haven't seen part 1 yet, I recommend starting there. Hi, I'm Dr. Allison Wu, physical therapist and board-certified clinical specialist in neurologic physical therapy. The more we help our stroke patients put weight into the weak leg, the more signals are sent from the leg to the brain to help the rewiring process occur faster. Today, I'll be sharing some exercises that will assist in that rewiring. My friend and client, Alex, will be joining me today to help with the demonstrations. An exercise that I really like to do is called the Clam Bridge Combo. The focus here is to strengthen the glutes and hips. Remember, no butt, no balance. All right, so Alex, go ahead and bend your right knee. Good, bend your left knee. Okay, so because the side hips and the back hips are both weak, we need the side hips so we don't drop when we're walking. We need the back hips to stay nice and tall. This exercise works both of them. I love to use bands. I tie it around his knees nice and tight. Okay. I find the slip knot to be the most effective, and I tell him spread his knees against the band. I give him a little bit help. This itself can also be an exercise where he's really trying to focus on spreading and holding for 15 seconds 10 times. He can hold for 15. If someone didn't have anything happening, you can help give the butt a little tap, help it wake up, fire up this muscle, help the patient feel that muscle, and just hold for 10 seconds, at least 10 seconds, so that the brain is so focused on sending signal to that muscle, you're also helping the brain make a new map of that muscle group. Once we've done this 10 times and it gets easier, then we do the combo where he spreads and lifts. Okay? Go ahead and relax. Good. If he holds it for 10 seconds, also rest 10 seconds. So spread your knees now. Good. And I'm giving the knee a sort of downward pressure to help him lift. And then go ahead and up, and hold 1, 2, 3, 4, 5, also 15 seconds. Super slow, come on down. Typically, when the weaker side is so much weaker, I like to tell him to bring the strong leg further down. Not that far, just a little bit, so that more work is being focused on the weak side to lift. So, spread the knees again. Good. And then lift your bottom. Good. And I challenge them to hold at least 10 seconds. When that feels easy, 15 seconds. 20 seconds, 25 seconds. The goal is to get to 30 seconds 10 times to really get these light bulbs firing fully on. We're thinking of this as the brain is trying to send more and more signal. It needs to better map to do that. Down the spine, all the way to those muscles, and get better communication with your lower half. Good, and come on down. That's exercise number 1. For patients who their leg tends to fall out to the side, then we could do the same exercise, but actually adding a pillow, a bouncy ball, or a beach ball between their knees, so they have to squeeze their knees together and lift their bum into the air. We'll make do with this for now, okay? Put this between your knees and you squeeze it together. And feet apart a little bit, okay? And lift your bottom up into the air without losing the ball. Good, hold, and I give the little downward pressure again. Another way to help facilitate, I like to sit right here on the bed with the patient and give them this pressure. Usually with your shoes off would be great. And the ball ran away. So that's a really good challenge for the patient. Helps them find their core a little bit also. Again, 15 seconds. So you can do a set spreading to find the butt, a set with the ball in the middle, or even a fat pillow folded in half between the knees to wake up the inner thighs, the inner hips with the bum. So that when they're walking, they won't be stuck turned out like this. Their leg will be facing forward better. This third exercise is going to be focused on the trunk, because remember, not only is the arm and the leg weaker, but also the middle. So I like to challenge my patients, and I pull them all the way to the side, and I tell them, use these abs, get your legs back into the middle, go, 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 go. Now the tendency is for the patient to use a strong leg to completely help the weaker leg. So I got my hands in the middle, okay? And I really try to help cue this weaker side, get it up, get it up, get it up, get it up, go, 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 good. And Alex is focusing so well, so uses more of your obliques and your abdominals. Then we go to that side. Good, and come on back into the middle. Go, 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 go. Come on, come on, come on, come on, come on. Good, excellent. All right, and go, 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 go. Good, and he's really focusing well not to cheat with a strong leg, which is awesome. And we keep switching sides. I could do this 20 times with my patients to get their abs, their obliques, their abs working better for them. And this is also easier on the caregiver and the helper in bed. This last exercise is a little bit more challenging. It's a bit more work on the helper. Your body mechanics really influence how well you can do it for. But the more reps you can do, the better. So even if the leg is dead weight, when the patient focuses on trying to pick it up, bring it towards their chest, and kick it away, clearly you are doing all the work. Even then, just that motion of visually seeing their leg and trying to connect with it helps the brain also draw a new map. So I bring it all the way to their chest, support behind the knee and the bottom of the foot, and I tell them to kick away as far as you can. Hold, 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 go, 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 all the way down. And then I tell them pick it up, all the way, all the way, all the way. Good, and kick. Good, and up. Good, and kick. And up. Good, and kick. Up. And kick. And up. And kick. And up, and good. So notice, again, I'm using my entire body weight to do this motion. And my arms are just following. So it's not just this motion. Okay, now if the bed is also on the lower side, for tall people, kind of put one knee up, give your back some support. So you can also do the same motion, kick, and up, pick it up, go, 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 and kick, okay? So you get to play around and figure out how to help your own body hold so that you are using more, or if you need to be here, going back and forth, okay? The helper, the more you use your butt to lift, the happier your back, your shoulders, and your neck. Our body is supposed to be the strongest portion, so we're helping the patient figure out how to use it as well as ourselves. Thank you so much. That's all for today. Stay tuned for our next video in the series that deals with standing on the weaker leg and doing transfers. Let us know any feedback or questions in the comments box below. I love to hear them. I'm Dr. Allison Wu. Remember, we heal smarter, not harder.